In this village in the Afar region of Ethiopia, the traditional but atrocious practice of female genital mutilation is common. This woman does not want to be shown on camera, but 25-year-old Khadija does want people to know she was only 7 days old when she was forced to endure genital mutilation.
Because I was cut when I was 7 days old, I was unable to hold my urine for long, and when I must go, I have to endure an excruciating burning sensation. Later, when my menstruation began, the pain worsened even more, and after I got married, it was painful to have sexual intercourse with my husband.
She was married at 14, and a year later went through the difficult birth of her first child. After having 2 more children, she experienced renal complications that almost resulted in her death. Her situation, unfortunately, is not unusual. According to an Ethiopian health survey in 2016, 3/4 of Ethiopian females have had genital circumcision. And in the Afar region, 9 out of 10 females have been subjected to the practice, most before they were even a year old. A doctor at a hospital in Afar says it is hard to change the attitudes of families toward female circumcision because it is the cultural norm. But he says he can make it easier for women to deliver their babies.
We perform a de-infibulation procedure in which we make an incision in their vagina to recover the appropriate opening that the mutilation removed.
Other women come to the hospital to find a way to relieve the painful results of their circumcision.
Most of them are also very stressed emotionally. After receiving our pain-free de-infibulation services, they go back home feeling happy. Most of them vow to never let another woman go through female genital mutilation.
This woman, now a midwife, used to perform circumcisions.
When I used to cut girls' genitals using this blade, I always made sure it's very sharp, like this. Otherwise, the girls could go through severe physical pain.
She used to believe that her work safeguarded a woman's virginity and marital faithfulness.
That was my justification for doing it. But after attending trainings, especially by religious leaders and government, I now understand this practice is wrong and it can destroy a child's future.
Ethiopia's government is tackling the issue through public health services, but Khadija is determined to stop the practice now.
Whenever I find a parent that still insists on practicing female genital mutilation, I try to convince them otherwise. Their small girls shouldn't go through what I went through and live a similar gruesome life like mine.
The United Nations reports at least 200 million women worldwide have undergone some form of female genital mutilation. 44 million of them are 14 years old or younger. Deborah, VOA News.